Now, with that, I'd like to turn to Dr. Joseph. Dr. Joseph, as always, very much appreciated you presenting and being on the broadcast. And again, whenever we put up your clips online of your presentations, it always gets a lot of views, and the residents are very grateful for some of the up-to-date information that you provide. So with that, Dr. Joseph, I'll turn it over to you.
Well, thank you, Stephen. It's always a pleasure. And as I said earlier, Happy New Year to everyone. Today, since the vaccine is such a hot topic, I thought I would limit my comments to that. And I will share the screen. And if we can do that, are you on board with that? So this is how I see what's happening right now. We're looking at two very, very fast moving locomotives. And right now, the surging cases are still winning, but we want the vaccine train, hopefully within the next couple of quarters, within the next 6 months, to surpass the surging cases. And once that happens, and I'm confident that it will, once that happens, there's going to be major changes in what we recommend, and most importantly, what we can do. So this race is still going on, and it is not neck and neck. Unfortunately, the cases are winning, the hospitalizations are up, and there still are people who are not surviving this disease. I'm going to talk mostly about the vaccine, but let me mention one thing. And what I usually do here, as you know, Stephen, is I try to address the questions that I get on a daily basis and then try to answer those in public. Just a couple of comments about the variants. In the United States, we typically do not look for variants or mutations in viral diseases. Other countries do, particularly United Kingdom. Since United Kingdom, Denmark, South Africa have identified some stable variants of this virus, this is the coronavirus, then we are now starting to look more closely for variations or mutations. Currently, regarding the vaccines, the two that are out, they cover all of the variants. So they've all been looked at. The antibodies that respond to those who have been successfully vaccinated do cover the variants. Regarding diagnostic testing, there are three commercial tests that will not pick up the UK variant. That's the B117 variant, and that's disturbing. So now we have to look at variants around the world and evaluate our diagnostic tests to make sure that we don't miss any. And then I think it's been mentioned here before, but the variant of the UK, the concern of that one is that it is more infectious, more contagious. An individual who has that variant sheds more virus than the wild type or non-variation, non-mutated strain. So variants are in the future. Right now, vaccines are effective, but we must watch to make sure that the vaccines don't lose their effectiveness if there is a mutation. So let me talk a little bit about vaccines and try to answer some questions. These were the statistics that were reported to the FDA. And what I've done is I've combined both the Pfizer, BioNTech, and Moderna NIH vaccines in numbers. They were, as most people know, they were presented to the FDA advisory panels just a few weeks apart. Totally, there's about 36,000 who were vaccinated and were followed very carefully. 36,000 got placebo. The new cases of COVID, there were 20 in the vaccinees and 354 in the placebo. Now, you've heard that the vaccines have 94 to 95% efficacy. That is a completely different formula that has to be used by the FDA or by companies who are presenting information to the FDA so that historically vaccines can be compared. It really is a fantastic number because most of the vaccines that we have in the United States are somewhere between 50 and 75% effective. These vaccines are in the mid-90s. But to translate these results to what is important to an individual, it means that if a person is successfully vaccinated, and what I mean by successfully vaccinated means that they get 2 doses of vaccine and they have a good vaccine response, meaning that the blood test shows that the vaccine works. The risk of getting COVID is about 1 in 2,000. Now, all of this information is based on 36,000 individuals who have been vaccinated. But in the United States, we have already given vaccine to 16.5 million people. So a lot of information is expected to come out. All of the information that we have relayed to the general public and to our patients is based on the clinical trials. Now we are gathering data on very large number of patients, including side effects, efficacy, the duration, the durability. Will it work against the variants? And if we have this same ratio, that is that the vaccine doesn't prevent disease in about 1 in 2,000, we can anticipate of those 16 million people who have been vaccinated, there may be about 8,000 new cases. That means about 8,000 people will not have a good response to the vaccine. Those are the current numbers that are projected, and actually we hope that it's truly much better. So this is a work in progress. We start off with a small number of people, but then you can see how many people have been vaccinated, and the monitoring is going on in a much more robust fashion now, so that we can be sure that the vaccines are the right ones and the ones that work. And this is just two of the products that are released now. There will be 3 others released relatively soon, 3 other vaccines. Another question that I think I get as much as any is pregnancy. Now, in the clinical trials, a woman who was pregnant was not permitted to enroll in the trial. So of those 36,000 individuals, 18 were subsequently found to have been pregnant. At least it wasn't identified at the time of the trial, or they got pregnant unintentionally during the trial. All women who were enrolled in the clinical trials were advised to defer pregnancy until the study was over. So there was only 18 women in clinical trials. What I can tell you about all of those is there was no complications from the vaccine, no complications. Finally, we can now say there were no complications to the baby either. But what is more important is what was published last week, and that was the single study that we have in the United States. So this is out of Boston at a very, very good series of hospitals. Over 6,000 women who had COVID at some time during pregnancy. And then the study compared that to over 400,000 women matched for age who did not have pregnancy. And this is what we know as of today. Those who were pregnant had much more severe COVID disease. They had a 26 times the incidence of being hospitalized with respiratory failure, mechanical ventilation, which is really what one is trying to avoid the most with this disease. Also, substantially higher rates of preterm labor, preterm birth, preeclampsia, thrombotic events, and other complications of pregnancy. Now, what we know so far is that there's no identified complications from the vaccine to either mom or the baby, but we are very early. But because of the complications of the disease, the CDC and the American College of Obstetrics and Gynecology both state that the vaccine is not contraindicated for an individual who is pregnant. Now, that's not true of all vaccines, but for those who are pregnant, the vaccine is not contraindicated. So now it comes down to an individual decision, and I truly respect the concern that mom would have about this vaccine only having been available for a couple of months, only having been studied since last July. So the final bottom line is this: avoid COVID during pregnancy. That's where it becomes an individual decision. If a woman is working in a setting where she is likely to be exposed to COVID, the vaccine should be considered and taken. An example would be an ICU nurse, a first responder, someone who's in the emergency room, someone who is a medical office where patients are coming in daily. That is a continuing exposure in a community that is still surging with virus. Now, the opposite would be someone who says, look, I don't work, My husband works from home. We never leave our house. We don't even have a bubble. There's no possible way I'm going to be exposed. Well, that woman then might say, I'm going to hold off on vaccine and evaluate each month. I have never advised someone not to get vaccinated during pregnancy, but I have advised many people that your situation and your risk is so low, maybe you want to hold off and evaluate every month. So it's an individual decision, but most important, avoid COVID during pregnancy and take whatever measures that apply to you. Now, this has been alluded to already. After the vaccine, if a person is successfully vaccinated, and if you notice, I'm always using this term successfully vaccinated, meaning that you've had 2 doses and the vaccine works. That is, the blood test shows that the vaccine worked. Can you spread disease? Well, this is unknown. Now, we, in the field of theoretic science, we think it's extremely unlikely because this does not occur after any other vaccine preventable respiratory disease. So for example, measles, mumps, rubella, if one is successfully vaccinated, those are respiratory diseases, and they get exposed, they will not get infected. The reason this is a little bit different is not only because we're so new into this disease, but if there is a variant or a mutation of the virus and the vaccine doesn't work against that, then that person can get infected and spread disease. So until we have more information, we are assuming that it's possible to spread disease. And I can assure you studies are ongoing to answer this question in a scientific fashion. Are boosters coming? Yes. So in analyzing the blood test response to vaccines in the clinical trials, it looks like this vaccine is lasting longer than originally thought. It looks like the vaccine will last at least a year and maybe longer. So for that reason, booster studies in those who are in the original clinical trial have been postponed and will not start until July. But every month, those 36,000 people who enrolled in the clinical trials are being followed to see if their blood tests are still showing a lot of protective antibodies. And if they are, then the timing of the booster will be pushed out even further. So at least for the 2 vaccines that we have right now, they appear to be effective for at least a year. Now, what about a vaccine passport? And a vaccine passport means, will you be asked to show that you have had a vaccine to either get on a plane, enter a country, return to the United States, go into a restaurant, go into retail? And probably yes is the answer. There's precedent for this. So those of you who are world travelers know that there are many countries in the world that you cannot cross the border unless you have proof of yellow fever. If you have a yellow fever vaccine, you can enter the country. If you don't, you cannot. That's a precedent. In healthcare facilities, it's common during flu season to require healthcare workers to have a flu shot if they're going to work on a ward without a mask. So there is precedent for this. And as time goes on, this may become an important part of the future. Now, this was alluded by others. Should we continue masking, distancing? And what about an exposure? If an individual has received 2 doses of either Pfizer or Moderna vaccine and they get exposed, do they have to quarantine? And what about those individuals who work in facilities where they have to be tested on a regular basis, whether it's every week, every 2 weeks, every month? Should they continue to be tested if they've had the vaccine? And the answer to all of these is yes, based on this graph. Now, this is not a Contra Costa graph. I was pretty familiar with it. The Contra Costa stuff would be presented by others. But as you can see, this curve has not turned around. This is a contemporary curve. This shows what's going on as of this month. And the new cases, the hospitalized individuals, and the deaths have not started to decrease. Now, once this curve turns around, and I'm optimistic that it will, once this curve turns around, we will be reevaluating on a national level. Do you need to mask and practice social distancing if you've been vaccinated? If you have been successfully vaccinated and you're exposed to someone, do you need to quarantine? And what about recommended testing? I work in a facility where I have to be tested every week, and I have been vaccinated, but I still have to get tested every week. If we see this coming down, and as we get more information, then that too may change. So just in summary, right now the vaccine looks very, very good, but it is too early to say that having the vaccine will alter anything that we do on a daily basis. And then my last slide is this. This still is the recommendation. The basic 5 measures to protect yourself from getting COVID. Universal face coverings when you're out of your own house and especially indoors. Physical distancing of still at least 6 feet, even outside. Avoiding crowds and congregate settings. You all know now that outdoors are much safer than indoors because of air circulation and air exchange. And that's what protects us from this virus. This is a respiratory virus. It's in the air, and the more air exchanges, the better. And then finally, hand washing or hand sanitizing continues to be critically important. And so with that, Steve, I will stop. I'm not going to talk anymore. It's a vaccine day. These represent the majority of the questions that I get. So thank you very much.
Well, thank you, Dr. Joseph. As always, love your presentations. And I think there's this general perception that once the vaccine's out and everybody's vaccinated, we no longer have to worry about it. But you're showing us that there's still a lot of work to be done to understand all the mutations and everything that's going on with the virus. So again, really appreciate your presentations. And
Thank
now
you.
I'd like to turn it over to Simone. Simone, I'm sure we have some questions for Dr. Joseph and Supervisor Anderson.
The next question is for Dr. Joseph. Besides the Pfizer and Moderna vaccines, are any other companies close to applying for emergency use authorization from the FDA? You alluded to this earlier.
Yes, 2. AstraZeneca will be, they're gathering their data right now, and they should be applying within the next month, followed shortly by Johnson & Johnson. Of the top 5, we now have 2. Those are the next 2. Both of those vaccines are an entirely different platform. The 2 vaccines that have been released are based on messenger RNA. These 2 vaccines use a viral vector. They're completely different. The AstraZeneca vaccine is from England, is being used over there, and that requires 2 doses. The Johnson & Johnson vaccine was developed in the United States and is a single dose vaccine. I can't comment on the effectiveness compared to what we have now because the information has not yet been released to the public.
Thank you. Next question is for Dr. Joseph. Within the last week, several countries have updated mask mandates to require either an N95 or surgical mask to offer the wearer more protection from virus particles. So with the new variant circulating, should we be wearing masks that can offer particle protection for ourselves and those around us?
We haven't gone there yet because of the lack of availability of the high filtration masks. So the N95 or the KN95 has very specific performance specifications, meaning that it will filter 95% of particles of 0.3 microns or less. That only works if the mask is fitted tightly around the face. So it has to be fitted over the nose, over the cheeks, around the jaw, and under the chin, so that on inhalation, air must go through the mask. The ones that are being sold commercially, most of them are KN95s, meaning they're made in another country, are loosely fitting and provide very little more than tightly woven cotton. So in a hospital setting, or when we're caring for patients who have an infectious disease that is spread by respiratory, we wear a mask that is so tight around us that we actually have to go through testing to prove that nothing goes around the outside. That's fantastic. But just to put that on someone without specialized testing is misleading. So the answer, no for the United States. Tightly woven cotton or layered cotton is still equally as effective as a loose fitting KN95 or N95.